Dr. Matthew Devine, the medical director at Highland Family Medicine, is back with us this morning. Doctor, thanks for a few minutes.
Good morning.
Dr. Fauci recently talked about eye protection as a way to prevent COVID-19 infection. For some folks, they've already been using this, haven't they?
Yeah, so currently there are no rules for just the general public to wear eye protection, but health professionals have been wearing them essentially since the start of the pandemic.
So the question is, for the general public, when would one consider wearing eye protection as a way to try to ward off COVID-19?
So I think the biggest thing is good news is it's very unlikely but possible that COVID-19 infections can happen through the eye. And it's essentially mucosal surfaces that we've been worried about this whole time. So it's the mouth, the nose, and the eyes. And so if you want to maximize protection, then obviously you'd need to have eye covering to do that. But obviously the more common locations are through the nose and mouth.
Who are some of the types of, what are some of the types of positions where one might want to consider wearing eye protection?
Yes, I think if you're in a situation where you're really unable to avoid some of the social distancing measures we had in place for an extended period of time, then you want to put eye protection on. Best examples of that are if you're having to kind of fly in an airplane somewhere where you're in close proximity to another person, people, as well as example like hairstylists who are kind of having face-to-face contact with multiple people throughout a daily shift.
All right, we say eye protection, so the question is, what do we mean when we say that? You know, we're talking about a regular pair of glasses? Just, you know, what do we mean?
Yeah, so I think when we talk about eye protection, you know, there are regular eye safety goggles kind of like this that are like sunglasses or regular glasses, but keep in mind, you know, these are open from the top, sides, and bottom so that they can kind of sort of get aerosolized particles through. We also have face shields kind of like this that go ear to ear, and they can obviously prevent splashes and things like that and kind of offer a little bit more protection. I think any way you want to do it, you want to make sure that these things fit snugly from the corners of the eye across the brow. And I think the biggest thing obviously is making sure that you don't touch your eyes. And that's the main point of it while you're wearing these devices.
All right, doctor, our time is short. We'll leave it there. Another layer of protection in the fight against COVID-19. Again, thank you.